Welcome to This Explainer. Today, we're going to completely flip the script on how you look at workplace health, safety, and the environment. I'm super excited to guide you through this, mainly because this is a topic that literally impacts every single one of us who steps out the door or just logs in from the living room to do a day's work.
So let's just jump right in. Be honest, what immediately pops into your head when you hear the phrase health and safety? Do you instantly picture a giant mountain of boring compliance? Just bureaucratic red tape? Or maybe an annoying administrative burden that just slows everything down?
Well, we are going to completely shatter that misconception right now, because at its absolute core, this whole thing is not about punishment, and it is definitely not an excuse to kill progress. It's really about one fundamental thing: preventing harm. Think of it as a giant safety net. Whether we're talking about preventing a visible accident or an invisible disease, it's about keeping human beings safe and making sure every single person goes home in one piece.
To systematically demystify all this, here is our roadmap for today's explainer. We're going to cover 1. Redefining health and safety, 2. Decoding the terminology, 3. Safety versus health risks, 4. The 3 pillars, and 5. A shared responsibility. Simple as that.
All right, kicking things off with Section 1, redefining health and safety.
So, health, safety, and environment, or HSE as it's usually called, goes way beyond just slapping up a yellow wet floor sign. We are talking about a comprehensive set of principles designed to safeguard human lives and minimize occupational hazards. But it also scales up to protect the environment through sustainable management. And, crucially, it prioritizes employee health and well-being. And, that doesn't just mean physical health. It includes mental well-being, too. It's really a strategic investment in the absolute most valuable asset any organization has: its people.
Moving right along to Section 2, decoding the terminology. Let's bust some of that industry jargon, right?
Let's do a quick lightning round. First up, a hazard. A hazard is simply the potential of something to cause harm. Literally anything. It could be a trailing wire on the floor, a bucket of toxic chemicals, or a massive piece of machinery. The hazard is just the source of that potential danger.
Building right on that, we have risk. Now, a risk isn't the hazard itself. Instead, it's the actual likelihood that the hazard is going to cause harm. To put that into perspective, a toxic chemical securely locked away in a reinforced vault, that's definitely a hazard. But the risk of it actually harming someone right now? Super low. And finally, a near miss. Think of this as an unplanned event that didn't cause damage this time, but absolutely could have turned into a full-blown accident. Imagine a heavy box falling off a top shelf and landing like inches from someone's foot. It's a huge warning sign that your controls need an update before a real accident happens.
With those terms locked in, let's dive into Section 3, safety versus health risks.
You can really think of this dynamic like a giant iceberg. People almost always say safety first because safety hazards are those instant, visible threats floating right above the water. A fall from a height or getting caught in machinery. The consequence is happening right now, right in front of you. Health risks, though? They are the invisible, long-term dangers lurking deep below the surface. We're talking deadly dust, toxic fumes, or slowly losing your hearing over time. The consequences don't hit you immediately. They sneak up on you years down the line. To really show you what I mean, take a look at this sobering data from 2022. Visible safety accidents killed 123 workers. And obviously that is 123 too many. But compare that to the health risks. A jaw-dropping 13,000 deaths were linked to past exposures to hidden health hazards at work. 13,000! That just goes to show why the health part of health and safety can literally never be an afterthought. And that staggering reality brings us right to Section 4. The 3 pillars. So why do we actually do all this? Well, at the absolute foundation of it all is the moral pillar. Look, the whole employer-employee dynamic is just a financial exchange, right? Skills and labor for a paycheck. But people go to work to earn a living, not to get hurt or die. Morally speaking, causing harm to someone on a human level is just flat out wrong. Nobody signs up to exchange their life or their health for a day's work. Then we have the legal pillar. We've come a massively long way from the brutal working conditions of the 1800s. Early laws like the 1802 Act for the Preservation of Health and Morals were mostly just for apprentices in mills. But the real game changer? That was the 1974 Health and Safety at Work Act. It created a rock-solid backbone of protection across all industries. And then it was strengthened even more by the 1992 and 1999 regulations, which laid out very specific legal duties of care.
Now, you might be wondering, does all this legal red tape actually do anything? Well, yes, it absolutely works. The data is incredible. There has been a monumental 90% drop in workplace fatalities since that 1974 Act was introduced. 90%. It totally proves that creating regulations and actually enforcing compliance literally saves thousands of lives.
And finally, the financial pillar. Say you completely ignored the moral and legal stuff. Bad health and safety will still absolutely destroy a business financially. Failing to protect your workforce puts a massive dent in productivity. You aren't just paying for the immediate damage. You're paying for sick pay, huge operational shutdowns, costly investigations, recruiting and training new staff, and potentially crippling legal fines. The truth is, good health and safety actually saves you a ton of money. So to avoid those financial disasters and stay legally compliant, businesses use risk assessments, and it's actually an incredibly straightforward, actionable 5-step process. Step 1, check the workplace for hazards. Step 2, decide exactly who could be harmed and how. Step 3, put precautions in place to prevent or control those risks. Step 4, record and communicate your findings so everyone is on the same page. And Step 5, review and update your assessment whenever the workplace changes. Easy, right?
Which brings us to our final section, Section 5, a shared responsibility. Taking all this theory and putting it into practice, that is a total team effort. The ultimate burden definitely falls on the employers, since they control the work environment. They have to provide adequate training, maintain a safe space, and document their policies. But employees have major duties too. Workers absolutely have to take reasonable care not to endanger themselves or the people around them. They've got to use equipment properly, and they have a duty to report any dangers they spot. The safety net only holds up if both sides are doing their part.
And that teamwork is more essential today than ever, simply because the landscape of occupational hazards is just so diverse now. Yes, we are still managing traditional risks like falling from ladders or slipping and tripping, but we're also battling totally modern health issues. We're seeing repetitive stress injuries and crazy eye strain from staring at screens all day. Outdoor workers are facing way more extreme weather exposures. And with the huge rise in remote work, we are dealing with the long-term health impacts of sedentary workdays and physical inactivity. It really covers the whole spectrum. So as we wrap up this explainer, I want to leave you with one final provocative thought. We just saw how these practices led to a 90% drop in fatalities, but we also saw the silent, devastating toll of 13,000 hidden health-related deaths in a single year. Knowing that thousands of human lives are literally on the line, and knowing that preventing harm is everyone's shared duty, how will you approach health and safety tomorrow? Are you actively building a true culture of safety, or are you just checking a box?